This video presentation is about the analysis and modeling of the heritage health price data. It is a group work by STSU students of the data mining course taught by Dr. Kaur. Before we proceed further, let's know what this video covers. First, we will cover some background about data mining and heritage health price competition. Then we proceed to our motivation and objectives of the project. We will talk about our data preparation steps and modeling steps. Finally, we will conclude with our conclusions. In data mining process, CRISP model is very popular and commonly used approach for data mining. It refers to cross-industry standard process for data mining. Steps to implement for this model are: first, business understanding; second, data understanding; third, data preparation; fourth, modeling; fifth, evaluation; and sixth, deployment of the model. Like in any other data mining steps, the first step is to understand business, so we should know about the source where our data is coming from. Heritage Provider Network is an incorporation established in year 1979 and has network in Southern and Central California. Their mission is to offer members a broad range of medical care, establish a robust provider network, deliver quality healthcare by equipping staffs with ongoing education, modern facilities, and comprehensive electronic data. Today, Heritage Provider Network is comprised of 2,100 primary care physicians, over 30,000 specialists, and numerous affiliate hospitals. It is one of the most competitive and cutting-edge network providers in the nation and one of the largest in California. American Hospital Association claims that more than 71 million individuals in the United States are admitted to hospital each year. In the year 2006 itself, over $30 billion was spent on unnecessary hospital admission. Heritage Provider Network believes that there is a way to identify patients at risk giving necessary treatment by not spending so much money. So, a breakthrough algorithm has to be developed that uses available patient data to predict and prevent unnecessary hospitalization. Once known, health care providers can develop new care plans and strategies to reach patients before emergency occur, thereby reducing the number of unnecessary hospitalizations. To motivate people all around the world, Heritage Provider Network is sponsoring the Heritage Health Prize competition. The winning team needs to create an algorithm that predicts how many days a patient will spend in the hospital in the next year. So, for our project, the motivation is we need to develop a model that helps predict and prevent unnecessary hospitalization for better healthcare. Our objectives are: first, to explore and analyze the heritage health price data; second is to develop a predictive model that can identify patients who will be admitted to hospital within the next year using historic claim data. Our first task is to analyze heritage health price data. The raw data sets we have were comprised of: first, member table; second, claim table; third, lookup table. In the member tables, there were variables like member ID, sex, age at first claim. In the pie chart, if you see here, we can see the female patient, which is shown by the blue color, is more in number than the female patient, which is shown by the pink. And also, age at first claim were given in 9 different categories. This is a claims table. Here we can see the variables like member ID, provider ID, vendor, PCP, year, specialty, place, PC, wait delay, length of stay, DSFS, primary condition group, and Carson index. Here we can also see that the variable length of stay has very missing values. Sorry. Here we can see that the variable length of stay has a lot of missing values. Here we see the primary condition group table. We can see the different codes and the description given of the disease in here. This is the days in hospital table for Y2, which means year 2, and we can see the member ID and the days in hospital given in here. And if you see the data sets, the histogram of the data sets, we can see that the percentage of the patients who got hospitalized is very less in compared to the patients who didn't have to be hospitalized. This is the distribution of sex by days in hospital year 2, and here you can see that the female patients were more in compared to the male patients. This is the distribution of age at first claim by our target variable days in hospital year 2, and here you can see that the old patients were high in number in compared to adult and young.
The diagram for the first step datasets provided. This diagram shows a quick idea about the perspective of this project. We are going to use claims data provided for the first year to predict days in hospital for the second year. We need to organize the data provided in the claim table, member table, and the second year days in hospital. Number of observation in the claim table is almost 650,000. Number of unique members is almost 77,000. So we can conclude that each member has several claims in the first year. Because the real data for the second year days in hospital has been presented just for each individual members, around 77,000, then we need to make a new data set for each member containing all information in the claim table, age, gender, and days in hospital for each member. The mentioned table will contain unique member ID, age, gender, days in hospital as a predicted variable, and organized information from claim table for unique members. As I said before, merging and organizing the information provided with the claim table is necessary. In the following sample claim table, you can see information for 3 members. Each member is distinguished by different color. First member has 7 claims, second has 5 claims, and the third member has 4 claims. Moreover, the place of service, specialty, primary condition group, and length of stay are different for each claim. An idea to deal with this various information for just one member is shown in the following diagram. We need to put 12 groups information horizontally corresponding to each member. It means we need to find out each member how many times has referred to the laboratory, how many times to emergency, and so on. Other predictor variables in claim tables such as place of services, primary condition group, and length of stay and pay delay have different levels. 8 levels for place of service, 45 levels for primary condition groups, and also we can put sum of length of stay in different claims for each member, and also the same way for pay delay. In order to implement the explained idea, we need to find, compute, and substitute for almost 650,000 observations. Due to the having a very large dataset, Excel couldn't handle the required computational procedure and memory. Visual C++ is used to create the comprehensive data table for unique members. Visual C++ can handle the memory and optimized computational algorithm. Due to the using optimized algorithm and high-speed nature of Visual C++, the speed of written program was so high. This is the dialog box for opening the initial file, which containing the merged information for almost 650,000 observations. By clicking on the shown tab in the toolbar, you can load your file. Here, the raw data.csv is loaded. If the loading process was successful, you can see confirmation message. This message also shows the size of loaded data that you can need to confirm. And then the file containing the combined information for unique members is built in the same path with the initial file.